Now let us start learning about individual space maintenance. Now we can learn the space maintenance topic in two ways. One way is to learn the individual space maintenance and try to understand where do we use these space maintenance. And another way is to learn situation-wise. For example, if we learn band and loop space maintenance, its use, and other aspect is space maintenance in case of posterior tooth loss. Now we have to think about options for space as a space maintenance when the posterior teeth have been lost, and we can talk about the band and loop, crown and loop, or lingual arch, and so on. While I feel that for a fourth year student, if the student is aware about the various individual space maintenance, it is easier for that student to apply the knowledge whenever a situation arises or whenever the question is asked about a certain situation. So first space maintenance, the band and loop space maintenance. This is indicated when a single posterior tooth, a single molar has been lost. Here we can say a band is placed on the posterior abutment tooth and a loop is soldered. And the loop is soldered to it. The characteristic features of this band and loop space maintenance, it is a fixed appliance unilaterally placed. It is one of the most commonly used space maintenance. It is used for single tooth loss span in the posterior segment, and it can be used bilaterally when the permanent teeth are not present. So this can be used bilaterally when there are no permanent molars erupted, no permanent incisors erupted, and bilateral loss of first primary molar has occurred. But commonly it is used in a posterior tooth loss, a single posterior tooth loss cases. The advantages of the band and loop space maintenance are as follows: that it is quite effective in unilateral tooth loss cases. It is quite simple to construct, considerably economical. When we use preformed bands, it takes less chair time. And the disadvantages are, now remember that these are the disadvantages practically of all the fixed space maintenance that use bands. So the first and foremost disadvantage is decay or caries regions under the bands. Then the band might impinge on the gingiva. And third, just because the space maintenance is not functional, it does not prevent any supra-eruption of the opposite tooth. So these are the advantages and disadvantages of band and loop space maintenance. Now, up to what age we should place a space maintenance? Here is a photograph, a picture, an image, which is showing the space maintenance in place. As soon as we get to see a tooth erupting, the space maintenance should be removed. So ideally the space maintenance should be placed as soon as the tooth is extracted, and it should be removed as soon as we get to see an erupting tooth. Next is crown and loop space maintenance. This is used in the same cases as band and loop, that is single posterior tooth loss. But in addition, if the abutment tooth, if the posterior tooth needs a multi-surface restoration or a pulse therapy, in other words, if the abutment tooth is an indication for stainless steel crown, the abutment or posterior tooth receives a stainless steel crown and a loop is added to that crown, making it a crown and loop space maintenance. It is one of the most retentive space maintenance. The characteristic features are that it is very much stronger as compared to band and loop. The failures of cementation are very less likely to occur because the stainless steel crown is considered to be one of the best restorations in the field of pediatric dentistry. So, single molar loss, where the posterior tooth or the abutment tooth needs crown or is indicated for crown, this situation is an indication for crown and loop space maintenance. Third is lingual arch or lower lingual holding arch. teeth have been lost, either unilateral loss of multiple teeth or bilateral loss of multiple teeth in the mandibular arch. In this space maintenance, the bands are placed on the last molar and the wire runs on the permanent central incisor just above the cingulate. This makes the anterior stop, and the objective of having this anterior stop is to prevent the mesial drifting of these molars. Lingual arch, the objective of placement of lingual arch is to preserve the arch length, the arch perimeter, by not allowing or by preventing the permanent molars moving mesial. If the primary incisors are present, if the permanent incisors have not erupted, then lingual arch space maintenance is not indicated. The advantages of the lingual arch are, it is very convenient. There is no inconvenience, because in this condition, if you place a bilateral band and loop space maintenance, it becomes too bulky. So the preparation, the fabrication, the placement is little easy, little convenient for the dentist, for the child as well. It is not conspicuous because the wire runs lingual, so it is not seen, and it serves as a space maintainer for more than one. Also, it allows or it permits the individual teeth movement in the adjacent areas. The disadvantages of the lingual arch space maintainer are the same, like decay under the bands or the impinging, the bands getting impinging on the finger. Where the hygiene maintenance is not proper, or the child receives some trauma. So in these cases, it can be traumatic to the child. Another space maintainer, next space maintainer is a Nance Palatal Arch or Nance Palatal Appliance. This is used in case when there is multiple teeth loss in the maxillary dentition. So if the situation is loss of multiple teeth in the buccal segment of maxillary dentition, in the posterior segment of maxillary dentition, then the space maintainer of choice is Nance Palatal Arch or Nance Palatal Appliance, where the bands are placed on the first permanent molars and an acrylic button is placed at the anterior slope of the palate, which prevents any mesial movement of these molars. So, and one more thing, that the bilateral design or the cross-palatal bracing, it helps in prevention of the rotation of maxillary molars, which most commonly occurs around the palatal root of the maxillary first molars. If the situation is that the child has lost multiple teeth in the maxillary dentition, and the child has some palatal lesion due to which a Nance holding arch cannot be used. In this situation, another option that is available in the form of Transpalatal Arch, TPA or Transpalatal Holding Arch. This is also used in case of multiple teeth loss in the maxillary dentition, especially molars. And if the loss is unilateral, maybe one or two or three teeth have been lost unilaterally, this is the space maintainer of choice. In this, there is no acrylic button, so there is no tissue irritation. And furthermore, as the Nance holding arch has an acrylic button under which the food lodgement can take place, and that can lead to bad breath and many other complications. So those complications are prevented with the help of this Transpalatal Arch. Another space maintainer, which is a very popular one in the field of pediatric dentistry, is a distal shoe space maintainer. And the situation. Now, when we talked about single tooth loss in the posterior segment, we can use a band and loop space maintainer or crown and loop space maintainer. If we have multiple teeth lost in the maxillary dentition, we have Nance holding arch, Nance Palatal Arch, Nance palatal arch and transpalatal arch. Then, if there are mandibular teeth, multiple teeth that have been lost, in that situation, we can always use a lingual arch. And there is another situation, a very tricky situation, where the second deciduous molar has been destroyed and it is not restorable. And the permanent first molar is yet to erupt. So we can see here in this picture the deciduous molar is completely destroyed and the first permanent molar is yet to erupt. In this situation, we have to maintain this space, manage this space, because while the first permanent molar is erupting, there are greatest chances of the tooth drifting mesially, causing space loss. And this is a very critical condition. In this situation, the appliance that we use is known as a distal shoe space maintainer, where a crown or a band, preferably a crown, is placed on the first primary molar, and to which we attach a horizontal and a vertical extension. This extension or this kind of a space maintainer, it goes deep into the tissue. The vertical arm of the distal shoe space maintainer lies 1 millimeter below the mesial marginal ridge of the first permanent molar. It always lies mesial to the first permanent molar, and this vertical bar, it guides the first permanent molar to erupt into oral cavity in its desirable position. If this particular space maintainer is not used, the first permanent molar surely drifts into the space, causing impaction of the second premolar. One thing that we have to always remember about distal shoe space maintainer is that it always has to be replaced with some other space maintainer, especially band and loop space maintainer, reverse crown and loop space maintainer, reverse band and loop space maintainer. Once the permanent molar has been erupted. So once the permanent first molar erupts, we have to remove that vertical extension of distal shoe space maintainer and convert the space maintainer into crown and loop, band and loop, reverse crown and loop, reverse band and loop, or I'll be showing de novo space maintainer. Now, distal shoe space maintainer needs placement of the vertical extension or vertical bar into the tissue. So we should always remember it not to use in cases in children or in patients who have rheumatic heart disease or who are at a greater risk of developing infective endocarditis, children who have blood disorders, children who are immunocompromised, children who have multiple missing teeth are there. So we really cannot use the tissue space maintainer in those cases. In children who are not able to maintain oral hygiene, again they are not good candidates for placement of the distal shoe space maintainer. When the first permanent molar is about to erupt, again there is no need to go for intragingival extension of the distal shoe. There are other space maintenance available for such a situation, will be shown in the next slide. And a rare case of congenital absence of first permanent molar. So in these situations, the distal shoe space maintainer should not be given. A modified distal shoe space maintainer or a pressure appliance can be given where we have relative contraindications. So these appliances can be used to help those first permanent molars to erupt in their proper positions. These space maintainers have the loops which apply pressure on the gingiva or the gum, and they are placed just mesial to the erupting permanent molars. So that now by using such space maintenance, we avoid any extensive or invasive procedures. So it can be easily used in children who are contraindications for the conventional distal shoe space maintenance. The history of distal shoe space maintenance is very interesting. It was introduced by Willet, And at that time, it was made of cast gold. Considering it, or the gold being a noble metal, it was thought that the intragingival extension made up of gold will not trouble the child or will not trouble the tissue. And so a horizontal and a vertical bar type extension used to be placed intragingivally, which was made up of cast gold. But then the preparation was too bulky and too difficult, so it could not become very much popular. Later, Roache advised or proposed use of a crown and a band appliance along with a V-shaped intragingival extension. Because of this broader surface, it helped preventing the rotations of first permanent molar, and it became quite popular there onwards. Now, there are certain situations. We talked about the loss of posterior teeth. Now, in case of loss of anterior teeth, we always need to think about something beyond space maintenance. The replacement of anterior teeth should be done for the aesthetic reasons initially, and then the space maintenance. We can use a removable partial denture or a fixed anterior space maintainer, also known as a Gropers Appliance, in which the bands are placed on the posterior most molars, and something like a Nance arch is prepared, onto which 4 incisors or 2 incisors, as per the requirement of each child, are placed, and this entire assembly is cemented. So this is a space maintainer, a desirable space maintainer in case of loss of multiple anterior teeth. So there are certain simple fixed space maintainers. As we were talking about the band and loop space maintainer, crown and loop space maintainer, lingual arch space maintainer, Nance arch, this Gropers appliance or Distal Shoe appliances, there is one thing common in all these space maintainers, that they need multiple appointments. The child needs to come to the dental clinic maybe 2 times, 3 times, and only then we can deliver those space maintenance. Now there are examples of single appointment space maintenance. There are modifications of space maintenance. There are simple fixed space maintenance, and they use the adhesive agents like composite resin or the fiber splints. So here are a few examples which use composite resin and a wire and a partially cut stainless steel crown placed on the posterior tooth. This is an example where a fiber splint is used along with the composite resin. These 2 are the examples. All these 3 are the example of single sitting space maintainers made up of fiber splint. Although they have lesser strength compared to the space maintainers made up of metals, but then they are quite convenient. It takes very less chair side time, and it is useful for children who are not able to spare 2 or 3 appointments or not cooperative for the impressions and all such procedures, or the parents who cannot come to us for fitment appointments. Maybe they have some other commitments and so on. Other modifications of single appointment space maintenance are de novo space maintenance, where the prefabricated bands are available in this form, and to which only a loop is to be attached, and this procedure can be done in a single appointment. Other example is an EZ space maintainer. Now these 2 types of space maintenance or modifications are placed in a single appointment and quite convenient to the dentist as well as the patient. What are the advantages of fixed space maintenance? First is its manipulation is easy. When we have preformed bands or preformed crowns, the time required is very less. They do not interfere with the passive eruption of teeth, adjacent, opposing. or the underlip. The succedaneous tooth, the tooth or teeth, they are well guided in occlusion, can be used for non-compliant patients, word uncooperative, or basically non-compliant patients. The removable partial dentures need also compliance on the parents and the patient side. And masticatory functions can be restored if the pontics are used in the fixed space maintenance. For example, the Gropers Appliances. The negative points about fixed space maintenance that it requires more armamentarium. There are chances of decalcification of teeth under the band. Then the chances of development of torque forces resulting in appliance breakage, and that leads to the trauma to the abutment tooth if by chance the appliance breaks. But then that is the case with removable as well. Then supra-eruption of opposing teeth is never prevented, and if pontics are used, then they can interfere with eruption of opposing teeth and prevent the eruption of replacing tooth if patient fails to report. Suppose if we have placed a fixed space maintainer and the patient does not report to us for next 2 years or 3 years, it can prevent the eruption of the subsidiaries tooth. Along with these negative points, there are certain complications which are shown here. So breakage of wire can be seen and the tissue can be hurt here or here. The loop breaks. Then chances of the tooth erupting in between that, and if the child does not report to us, it can prevent the eruption of the tooth. The wire can get bent because of the erupting tooth or shifting tooth. If the shoulder joint failure is there, then such complications can occur and the child's tissue can get traumatized. So these are